we're going to talk about feeding your newborn baby. The Academy of Pediatrics does recommend exclusive breastfeeding for the first 6 months of life, introducing solids at some point after 6 months, and continuing breastfeeding for at least 1 year or until mom and baby are ready to wean. Mothers do feed their babies in other ways, so there may be a time when formula supplementation may be needed, or a time when mother may do a mixed feeding of breast milk and formula. Your baby's first food will be colostrum. You already have colostrum available for your baby at birth in limited supply, and for about the first 3 days, that will be the superfood that your baby needs to grow. The baby will feed often, but take very small quantities of colostrum. A lot of times when moms see droplets of milk coming out in the beginning, they feel like that's never going to be enough to help a baby grow. But your baby's stomach size at birth is about the size of this marble, and it fits about 5 to 15 drops of liquid, which is coincidentally the same thing that will fill a teaspoon, about 5 milliliters. So that's why the teaspoon works really good. At about 5 days of life, your baby's stomach is more the size of this boulder, which is about 15 milliliters, and coincidentally about the same size as this medicine cup. So at 1 week, this is about how much milk your baby will take at each feeding. So still pretty small amounts. And by 10 days and getting closer to 2 weeks, baby's stomach can hold about 1 ounce or 1.5 ounces of food, which is about the size of this egg. And then each week of life, it increases by 1 ounce. So week 1, the baby will take 1 ounce, week 2, 2 ounces, week 3, 3 ounces, and by a month, they'll be taking about 4 ounces. So let's talk a little bit about the benefits of breastfeeding for baby and mom. So some of the benefits for baby are that the food is perfectly proportioned, that it also helps coat the digestive system so that harmful bacteria from the environment just kind of slide through. It also acts as a laxative to help the baby get rid of meconium. And it also protects them against things like allergy and asthma, and decreases their illness-related visits to the doctor in the first year of life. For mom, there are also a lot of benefits, starting with a decreased risk for hemorrhage after delivery. Also helps mom return back to birth weight more quickly. It can decrease her chances of type 2 diabetes later in life, and also of other metabolic diseases that may show up in women as well. So another benefit of breastfeeding just for the family too is that it doesn't cost anything. It's always available, so it's convenient whether you're traveling, whether you're at home. You always have it. It's at the perfect temperature, and it's easy to offer your baby. So one of the first steps of your breastfeeding journey will be learning how to latch your baby onto nurse. So latch is the key for establishing a good milk supply, and also making sure that your baby is transferring the right amount of milk so that they can grow appropriately. So while baby has a lot of instincts about feeding, like rooting and licking their lips, following their sense of smell to their source of food, latching is a learned behavior both for mom and for baby. So positioning is important, having the baby in close to mom during the feeding, having baby's belly turned toward mom's belly so that baby is in comfortable position and in good alignment, and then waiting for the baby to sort of lean their head back and open their mouth, and as they do, we're going to bring baby in and up and onto the nipple. With latch, it's important that the nipple lands in the back part of baby's mouth. That's what decreases the chances that mom will experience pain with the latch, and also allows the baby to compress exactly in the right spot to allow milk to transfer easily down so they can swallow it and take it down to the belly. With latching, unlatching is also important. Baby creates a lot of suction at the breast, so you always want to kind of wedge your finger in and gently break the suction between mom and baby as you're removing baby from the breast. So when you're learning to latch your baby, it's also important that you are comfortable and that your body is supported when you're holding the baby close to you. So I'll show you just one of the best holds that is used in the hospital and that moms find easy to use when they're learning how to breastfeed, and that is the football hold. So you're gonna position baby under your arm, and you're gonna roll their body towards you. The feet will be a little bit lower than the head, so gravity is helping baby swallow. You have one hand on the baby back of their head and neck so that you can control the latch. Latching is mother-led in the beginning. Baby will learn to self-latch about 4 to 5 weeks into breastfeeding. You have your second hand free to position your breast and support part of the weight to make it easier for the baby to stay latched on. So you can control the baby's head, bring them into latch. Once baby is latched, you can wrap your arm around and keep them nice and snug into mom, which helps them stay in the right position for breastfeeding. Mom should have pillows here or something to rest her arm on, and she should just in general feel comfortable in this position. Shift and adjust as you need to, because breastfeeding may take 15 minutes or 20 minutes, and if you're in a bad position, that's gonna later cause neck issues and shoulder issues because you'll be latching and feeding a lot. Are you ready to practice? Okay, so I'm gonna start out by handing baby to you, since are you gonna be a breastfeeding helper?
Yes.
Okay, so I'm gonna have you hand baby to mom in the football hold. Great job.
And then
You can do the left or right side, whatever you feel more comfortable with. So when you feed baby, you'll be feeding from both sides in the beginning, but whichever side you're most comfortable with is great. So you bring baby in that way, and then we need some support. So if I could have you get a pillow and put it right under her arm there, and then you're just gonna rest the weight of the baby on there so your shoulders are level, and then we're gonna have one on the other side. Yeah. We just want mom to be very comfortable. And then you're gonna support your breast with what we call a C hold. Just put it right underneath. And as you're waiting for that baby's mouth to open, they may be rooting or bobbing their head. And when you see that, you're just gonna guide them gently into the breast. There you go, good, excellent. Sometimes we wanna tuck this bottom arm in a little bit. Babies, when they're hungry, like to have their hands up by their face. So you can help by holding this arm back if mom has to latch on and off. In the beginning, the first time's probably not gonna be perfect. Again, we have to have practice, and you may have to do it 3 or 4 different times. Okay, does that feel pretty comfortable for you?
Yeah.
All right, awesome. So I'll have you hand the baby back to me. Excellent. Along with latching, we're going to talk a little bit just about feeding routines. So because baby has such a small stomach, they're going to have to eat often in the beginning. So if you're breastfeeding, you're going to breastfeed your baby about 8 to 12 times in 24 hours, or about every 2 to 3 hours during the day, and about every 3 to 4 hours at night. So it requires a lot of time commitment to do that, and you're going to watch your baby for feeding cues. So that's how you'll know when baby's ready to eat. So we're going to move on to talk just a little bit about pumping. So at some point on most mothers' breastfeeding journey, they are going to want to or have the need to express their breast milk either by hand or with a pump. And we have an example of a breast pump here today. This is a double electric pump. There are a lot of different types of breast pumps. Since 2011, it is required by law that your insurance company provide a pump to you, so you want to check into that. Also check in whether you can get it during your pregnancy, before delivery, or after the baby comes. Sometimes they will mail it to you, sometimes you have to go to a medical supply place. So just get a little bit of information about how to get your pump. They also may give you options of the types of pumps they give you. When you're pumping and removing breast milk, you want to think about how you're going to use it, and if you need to store it, how you can safely do that, and then use it later for your baby. So freshly pumped milk can sit out for about 4 hours at room temperature. If you're not going to use it within 4 hours, it's recommended you go ahead and put it in the refrigerator, where it can stay for about a week or 7 days. So if you're not going to use the milk within 7 days, you'll want to put it in a freezer where it can stay for about 3 months. And if you're going to save it beyond that, it can also be stored longer in a deep freeze for about 6 months. When you're storing breast milk, you always want to make sure you label it with the day that you are pumping the milk. And if you are pumping lots of milk and using it, you want to rotate your storage and always use the most recent milk first. Does anyone have any questions so far?
What if I'm not producing enough milk?
That's a great question too, and also a common concern that many moms have. So there could be some physiologic reasons to do with the mom, that mom may have some barriers to establishing a good milk supply, but the most common reason for low milk supply is not getting good breastfeeding behaviors in the early days. So starting in the hospital week 1, the more times that you latch baby, the better that baby nurses, the more often they feed. That's what sends the signals to mom's body to establish a good supply. When you miss feedings or you go a long time between feedings or baby is having difficulty latching and you don't reach out for help, that's when you can get to a point where your production may drop. So the most important thing is that a low milk production is normally reversible, but you need to have someone help you troubleshoot the cause for it and then put a plan in place to build your production back up again.
When is it okay to introduce a pacifier?
There's a lot of conflicting information out there about pacifiers, but the general rule of thumb and what the research supports is that once breastfeeding is well established, introducing a pacifier doesn't seem to present a problem for the baby. So many times along your breastfeeding journey, there may be some common reasons you may need support. Some of those reasons include maybe you're having difficulty latching or you're still having a lot of pain. Maybe you have a question about breast milk storage. Maybe you wonder if your baby's gaining enough weight, or you have questions about a product that you've seen. Great sources of support are a breast friend, someone who's been through the journey before, your baby's doctor or pediatrician, reaching out to a lactation consultant for support or help, or maybe an online breastfeeding support group or an in-person breastfeeding support group in your community would be all great places to start. So let's talk a little bit about formula feeding. In some cases, moms may choose to feed formula, or sometimes breastfed babies have to be supplemented with formula. There are many types of formula available on the market. It's good for you to look into the types and inform yourself on the different properties and nutritional components, and also learn how to prepare formula safely to give to your baby. You want to use a good clean water source. You want to make sure you're preparing it on a clean surface, and that you're constituting it with the exact instructions on the bottle so that the calorie and fat content is appropriate for your baby's age and your baby's needs. Bottle feeding, whether it's with formula or express breast milk, is great for your partner to be able to do. It's a good way for them to connect with baby, hold the baby the same way mom would, at a high level, at chest level. Make sure you're looking at making eye contact with the baby, and switch sides about halfway through the bottle feeding, which helps to mimic the eye stimulation and coordination that a breastfed baby gets when mom breastfeeds on both sides. So we've talked a lot about feeding. Next, we're going to talk about taking your baby home from the hospital and what life will be like with a newborn at home.